Of landmark papers for damage control laparotomy from the East Landmark Papers in Trauma and Acute Care Surgery online resource. Highlights that good outcomes after damage control laparotomy are not solely dependent on surgical technique, but on resuscitative efforts as well. It was a 4-year retrospective study at a single institution of 196 damage control laparotomy patients requiring 10 or more units of packed red blood cells during surgery, comparing conventional resuscitative efforts to damage control resuscitative efforts. Conventional efforts were defined as aggressive crystalloid resuscitation with no predefined transfusion protocol. Damage control efforts were defined as using a massive transfusion protocol with a 1:1 ratio of FFP to PRBCs and a 1:2 ratio for platelets to PRBCs while minimizing use of crystalloid. A 2-year period after institution of damage control resuscitation was compared with the preceding 2 years of the conventional approach. 124 patients were managed with conventional resuscitation and 72 with damage control resuscitation. Characteristics such as age, injury severity score, blood pressure, hemoglobin, base deficit, and INR were similar between groups. There was no difference in the intraoperative PRBC utilization between groups. Patients in the damage control group received less intraoperative crystalloid, more FFP, and closer ratios of FFP and platelets to PRBCs, with shorter ICU length of stay. Additionally, there was a greater 30-day survival. In conclusion, this was the first civilian study to analyze damage control resuscitation in conjunction with damage control laparotomy and illustrates multiple positive postoperative outcomes with correction of coagulopathy.